Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The Upstate Cancer Center now offers full-time spiritual care. Here with me to talk about this service are Kate Dunn and Tom Anderson from Upstate's Department of Spiritual Care. Reverend Dunn is an ordained Presbyterian minister, and Mr. Anderson is a lay chaplain who entered the field of clinical pastoral education after he retired in 2012. Welcome to the Informed Patient, both of you.
Thank you. Nice to be here.
And thank you so much, and equally so nice to be here.
I'd like to start by having each of you tell us a little about yourselves and how you got into spiritual care. Reverend Dunn, did you grow up knowing you would want a religious career?
Actually, I thought I wanted to be a writer and a novelist and maybe an English teacher. So I kind of fell into religion because I just got more and more curious. And I ended up going to seminary thinking that I would want maybe social work or counseling. And I started out doing about 10 years as a caseworker in supported housing. And then I ended up as an associate pastor and got ordained. I got ordained to a validated ministry with supported housing, but then I became an associate pastor in New York City at a Presbyterian church. It was just quite recently that I felt a change of call to hospital chaplaincy.
Wow. So are you a native New Yorker?
I did grow up in Clinton, New York. Yes, but I've been 35 years in New York City and I'm just coming back to my roots.
Now, I know you work in the Upstate Cancer Center. Do you have a personal experience with cancer?
I have a couple personal experiences with cancer. I have an aunt who died of brain cancer. My father died several years ago of lung cancer. But I think perhaps my most formative experience was one of my best friends from college who was a fellow religion major with me and who also went to seminary after college like I did. We were kind of on parallel tracks, and she found a lump in her breast when she was 22, when we were both 22, and we were 27 when she died. And I always think about Rosanna and what her life would be like now.
No, I'm sorry.
Yes, that's been formative for me.
Well, Mr. Anderson, tell us how a career at National Grid led you into spiritual care in retirement.
Well, it was an interesting journey. I actually retired from National Grid, but I was able to go to L'Arche, which is a residential community for developmentally disabled adults. And I spent a year and a half there. But I also was serving at St. Joseph's Hospital as a volunteer and befriended a sister of St. Francis who steered me toward clinical pastoral education and served as a mentor. And I applied, was accepted into the program, and trained under Reverend Terry Culbertson. And after I finished several units, went over to Krause Hospital for several years.
And now you're at the Upstate Cancer Center.
Yes, for the past 2 years, I've been at the Cancer Center, which has been just an incredible blessing to be here.
Now, I'll ask you the same thing. Do you have a personal experience with cancer?
Yes, like Kate, I have a couple of experiences. I have a sister who, at a very young age, had breast cancer. It was very serious, but fortunately, she came through that experience in a good way, although it was just a very difficult, a very long journey for her. And she has continued to have some issues. She had a recurrence, but is doing okay at this point. And my wife also had breast cancer. We were very fortunate. She had several sisters who were diagnosed. It was recommended that my wife be screened. She was, and they found early stage breast cancer that she had surgery for, followed up with radiation. And so walking that journey with her was quite an experience, very difficult for her, also difficult for myself too.
I imagine. Well, let's talk about the duties and responsibilities that you both have at the Upstate Cancer Center. What are your days like?
I think I'll let Tom take that because I've just been here about a month and he's been doing this for a while now.
The days are full, and typically for me, they begin by reviewing the schedule of people that will be coming in, both for infusion treatments, for appointments with providers, but also people that are coming in for radiation therapy treatments. And much of the time is spent walking the floor, just checking in with people that are here for their infusion treatments and trying to be a supportive presence to them as they would find helpful. And so sometimes it's just engaging in conversation, checking in, saying hello, whatever it might be.
How do patients connect with you?
Good question. Patients connect by referral from nurses. We speak with nurses, try to ask them if they know of anyone that might benefit from a visit. Also, we have patients that have been here in the past and have expressed an interest in being seen again. And so we will follow up with them. But we get a number of referrals from doctors, nurse practitioners, and from the palliative medicine group as well. So we have a broad base of staff members that ask us to touch base with patients that come in.
Now, is there a charge to the patient for spiritual care?
No, there is no charge. We provide this service at no cost. And again, just to be present to people. And it's recognized by administration that holistic care is necessary and important. And part of that holistic care is spiritual care services. And so administration has been incredibly supportive of our efforts in helping us to be able to come into the cancer center and make these positions possible.
Where do you meet with patients? Are you in the exam rooms with them or next to them while they're having infusions?
We meet with people in the infusion areas primarily, but also we do go up and speak with people occasionally up in the treatment rooms, exam rooms, up on their third and fourth floors where the providers see patients.
Do you have patients who request a chaplain of a specific religion?
Occasionally we get specific requests, but more often than not, my experience is patients and family members are most welcome simply to have someone be present to them, regardless of their specific faith tradition. And we
Th-
try to serve as interfaith chaplains. And again, just to be present as patients, would like us to be and find it helpful.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Tom Anderson and Kate Dunn from the Department of Spiritual Care at Upstate Medical University. Let's talk about some of the issues that patients may seek help with. Pastor Dunn, how might you advise someone who wants to reconcile relationships?
Oh, Amber, this is a really challenging question that I feel like it's a hard one to make without the context of knowing individual, situations and decisions. So I would really want to get a lot more of the information of the person's actual story in place, so it would depend. Like sometimes I would want to like have a person if they would want to invite somebody to come in, it would depend like how conflict laden the situation is. But often I would encourage people to reach out. I mean, if there's somebody that they really haven't spoken to in a long time, to make the effort. And I'm a big believer in prayer. And if there's somebody that is on someone's heart and that they're afraid because it's been a long time and there's a lot of like heart conflict around, would recommend really praying for themselves and for that person and for the relationship and really giving it over to prayer and then taking the risk and taking the courage because reconciliation is a great and wonderful gift, if possible. Not always possible, but if it is, it's a wonderful thing.
Well, Mr. Anderson, let me shift things a little bit. What can you say or do to help someone who struggles to understand why cancer is happening to them?
What I try to do in speaking with people about their diagnosis and treatment is to first begin by asking them to share story about what has happened, about their diagnosis, about their treatment. And a lot of times for people, these things come out of the blue, totally unexpected. And that is very difficult for them to try to get their arms and head around. You know, people always try to make sense and understand what is happening, why it's happening. And so what I try to do is just ask them to tell that story and ask them to tell me what it is that they are experiencing, but not just in the sense of relating a story, but what are they feeling? You know, what does that mean in terms of their daily life, what they're able to do, what they're not able to do? And just speak to those kinds of things. And people find it helpful to be able to have someone to speak to listen to, and not be directive, but ask them to explore, you know, how would you address this? What's important to you? What would help you move through this time? Who are the supports available to you in your life that you can reach out to? Including sometimes, is there anyone that is a resource, a support to you? And certainly, if there is a need, we in spiritual care help to fill that need, that role as well.
Pastor Dunn, do you come across patients who question their faith or believe they must be being punished when they're diagnosed with cancer?
Yes, absolutely. That's not uncommon at all for people to wonder if they've done something wrong. Is this a punishment for sin in some way? Or to think everything happens for a reason. So, what is the reason? That kind of outlook on life. Yeah. So, looking for the reason, like, why did this happen to me? Yeah. And so, yes, so that would make people question. I've always tried to be a good person. I've done everything right. I've always, said my prayers. I've always gone to church. I've always, what did I do to deserve this? And to really question their relationship with God. Yeah. So that can be very challenging. It can really also be an opportunity for people to expand their understanding of God and to really think about, who is God for me right now? What is my experience of God in this situation of of suffering that I'm going through, and where do I feel God? Where is God showing up for me right now? And what resources do I actually have spiritually and emotionally? And, so it can also be, yes, a great source of challenge. And it can be very troubling and disturbing, but it can also be an awakening and a real opportunity for growth. And some people find it the beginning of a really moving and illuminating spiritual journey, also.
Mr. Anderson, what do you say to someone who is fearful of death?
I will ask people that express a fear, what is it that you are afraid of? Because different people have different fears that they look at. Some people will say, I am afraid of the pain and suffering that I may experience. And we'll talk about that. Some people will be very upset, very fearful of the loss and grief around relationships, separation from family, and we will talk about that, explore that in ways that they can speak with family, talk with family about what they're experiencing, and also to engage in what I refer to as end of life work. If there are things that they would want to do, conversations they might want to have, places to go that hold meaning for them, to be able to do those things. But also, if people have a fear of what is going to happen to me, am I going to be able to go to heaven? Because as Reverend Kate has talked about, people thinking that they have done something wrong or whatever, try to talk to people about who is God for them, what of God's love, unconditional love, and how does that impact me, and how does that inform my faith, my belief in God, and my understanding of what is going to happen. And I also try to look at some scripture passages as well that might be relevant and talk about those with people, but really to address head on what those fears are that people are experiencing.
Well, I'm really glad to know that the Upstate Cancer Center offers this spiritual care on a full-time basis. And I appreciate both of you making time for this interview to tell us about it. Chaplain Anderson and Reverend Dunn. Thank you.
And thank you so very much.
Thank you, Amber. Very nice to be here.
My guests have been Chaplain Tom Anderson and Reverend Kate Dunn from Upstate's Department of Spiritual Care. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.